Good afternoon everyone, I'm Dr. Dhanraj Chan, resident in the Department of Dermatology at Krishna Institute of Medical Sciences, Karad.
And today we are going to discuss a case of a 38-year-old male who has come to us for his hair transplant surgery. We've done his surgery by the FUE method and a total of around 6,500 grafts have been planted. The consultation is the most important part of the whole process. Talking to the patient and understanding his expectations and how we can deliver it, making him understand that is important. Photography is to be done standardized way. All the staff in your clinic need to know what are the different angles and what are the different directions that need to be followed, and it has to be kept the same in every follow-up visit. After that, trimming of the hair is done. The whole head is usually trimmed. It makes the procedure very convenient and easy to perform. And some people also do the non-shaven FUE, but that is a different part. Trichoscopy and calculating the density is done, which helps in calculating the amount of grafts that can be harvested.
उसी में हम और डालेंगे और ये जो बीच वाला एरिया है इसे कॉन्सेंट्रेटेड बनाएंगे तो ये आप इधर डाल सकते हो इधर डाल सकते हो पीछे डाल सकते हो.
As the patient has been explained about the hairline and discussed with him, we go on to plan the donor area, mark the safe donor area zone from which we are going to harvest the grafts. Once that is done, the patient is then taken to the operation theatre. His head is washed. An antiseptic hair wash with betadine scrub is given. Procedure starts with the giving of local anesthesia. Any type of local anesthesia can be given. A nerve block, a tumescent anesthesia, or a ring block. Any way with which the surgeon is comfortable with can be used. Here we can see the tumescent anesthesia being given, and in front of that we can also see a ring block being given in the lateral parts of the scalp. Soothing music which makes the patient comfortable, which makes the surgeon comfortable, can be played because the surgery goes on for the whole day. Staying relaxed is very important. The making of the recipient site can be done by either needles or blades, and there are different ways of doing it. Some people like to do it in a coronal direction, some people like to do it in a sagittal section. Both of the ways can be done. Both of the ways have advantages and disadvantages of their own, and preference of both exists. You can do it however you are comfortable. There's no clear-cut guidelines to it. We do it in the sagittal way. Once the recipient sites have been prepared, we move on to the donor area, and the donor area we give a tumescent anesthesia. And then we start the harvesting process. First, the initial test grafts are taken. The test grafts are usually done with the help 2 to 3 punching is done, and then the assistant removes them, checks for the angle and direction of the hair in that particular area. As we move on and get comfortable with that area, we can go on with a faster speed. The assistant follows us through. The way my assistant is now removing the grafts is by the 2 forceps method. Even the 1 forceps method is done. If the 1 forceps method has to be used, a deeper punching has to be done. In the 2 forceps method, shallower punching is enough, and that reduces the dissection rate. The transaction rates vary according to the operator and the depth of incision, the angles of the hair, so it is very operator dependent. Once extracted, the grafts are then stored onto a chilling device or on ice trays, depending which we are comfortable with. The grafts, each one is examined and segregated according to the number of hair in it, 1, 2, 3, 4 hair units. The next step is the implantation step, in which can be done either directly with forceps or as we do it with implanters. It involves 3 teams. The first is the loading team, in which the assistants load the grafts onto the implanters. We can see the assistant loading the grafts into the implanter here. The place where the implanters are stored and the hand on which the grafts are stored both need to be moist, and at a time only 3 or 4, 5 grafts have to be taken on the hand to avoid desiccation. Once the grafts have been loaded into the implanter, it is then passed on to the planter who is there by the supplier. So the supplier just helps in transferring the implanters onto the planters, and that speeds up the process. So you can use 2 suppliers or 1 supplier depending on the speed of the planters and the speed of the loaders who are present. The planting team is usually 2 persons can do it on both the sides if you're doing only the plantation. And in that, what we do is both the planters on both sides of the head, with the help of a forceps, put the implanter inside the head, and as we can see here in a close-up view, the implanter is just slided into the pre-made hole, and with the forceps which comes from above the graft is slid into the hole. So there's no touching of the root involved here throughout the whole process, right from the beginning of the punching till the end, and that is what we call the no root touch technique. The beard harvesting is done in patients whom we need greater than 3000 2500 grafts. And in the beard, what is different is the beard attachment of erector pili is quite shallow, so we don't need to go in as deep to remove the beard graft. Just incising the surroundings very superficially can also remove the grafts. The advancement or the newer technique that was introduced by Dr. Pradeep Sethi and Arika Bansal in the 2013 paper is the direct hair transplantation technique, in which once the pre-made sites are done, simultaneously there's one person who sits below and starts implanting the grafts as the grafts on the scalp, in the lateral side of the scalp or beard, are being removed. This helps in reducing the time in which the grafts are outside the body and increases the survival rate of the grafts. The patient is very comfortable, and this steps is repeated again and again as a batch of grafts is removed, and once the surgery is complete, the patient is very comfortable and comes out walking.
Today with Mr. Vikram, we'll just understand how we have done his surgery in order to get the intricacies of the work that we have done. In total, we have done a total of 6,450 grafts for him in 2 days, and the way we have distributed the grafts is we have went in and planted around 3,500 grafts in the frontal area, concentrating about 2,000 grafts in this area, and in the crown we have planted around 1,900 grafts, and we have also built up his temple so that he gets a more younger look and it frames his face very nicely. So the temples have been done here and here. His special request was to fill the scar that he has. So we have repaired the scar also. We have planted around 200 grafts in the scar. The way we have taken his grafts is we have taken around 2,000 grafts from the scalp area, and the remaining 4,400 grafts we have taken from his beard. Very great density in the beard, and we took that both from below the mandible and from the cheek area. We have left his chin area so that he can sport a French beard if he feels like in the future.
This is how the patient now looks 1 year after the surgery. This is the top view and this is the front view. Definitely much younger than what he used to look. Thank you so much for watching.